Hey everybody, it's Dr. Elliott at Elliott Chiropractic. Today's topic is pain and posture. This is something I have to work on all the time because I'm like this with all my patients, having to work on them. And a lot of patients come in with postural problems and it causes a lot of pain in their spine. So one of the things you want to watch for, everybody's supposed to have a nice curve here, a nice curve here, right? Ears over shoulders, over hips. But a lot of people come in and they start to go forward, right? And then automatically what happens is their back contracts down like that, right? So they start to have headaches because their skull's going down on their spine. They start to have neck problems and they start to have lower back problems because everything is compressed together, right? So now the way we correct this is three things. One thing is we do adjusting. So if people are coming in like this, we adjust the spine to get it back this way and adjust the spine to get it back this way. Also, if they're contorted this way, we do what's called mirror image adjusting, which is getting the spine to come back to where it should be. The other two things is when you're like this and when you're like this, typically you're really weak here, right? And you're really tight up in here, right? And you're tight here and you're weak here. So we do what's called upper and lower cross exercises. And that allows you to come back this way, and allows you to come back this way. The third thing we do are fulcrums. So when your neck is forward like that and straight, what you want to do is, and we have to find the correct fulcrum for you, but when we find the correct fulcrum, we have you lay back on it, and what that does is it gradually over time starts to mold back to where it should be. Now we have no fulcrums for the neck, we have fulcrums for the low back, and not everybody needs a low back one because a lot of people are too far this way to begin with, so you don't, but some patients come in and they're forward. So we would do a fulcrum here, and if they're forward here, we would do a fulcrum here. Also too, for people with some slight curvatures, even a scoliosis, we'll have patients, let's say this guy's this way, so we'll have him lay on it this way. And if you lay on it long enough and often enough, you'll start to come back to where you should be, right? So three things: adjusting, upper lower cross, and there's a lot of other exercises too that we do to correct depending on what type of problem you have, and then the spinal molding fulcrums. This is Dr. Elliott at Elliott Chiropractic, and you guys have a blessed day.